The dental hygiene process of care provides a consistent framework through which the individual needs of a patient can be met. The dental hygiene diagnosis is one component of the process that requires a thorough patient assessment and informed decision-making. When a patient first comes in, we want to address their personal concerns and reason for visiting. These concerns should be our primary focus, while the overall objective is to gather information to get a complete picture of the patient's health. The first step is going over the patient's medical history. We look at infectious diseases, systemic diseases, medications, allergies, existing conditions, and the patient's dental history. This information will be important in helping us develop a safe and effective treatment plan for the patient. We always want to get the patient's confirmation for the information that we document in this step. Taking a patient's blood pressure is essential before proceeding with the dental evaluation. Our patient may not even know that they have a blood pressure issue. Being aware of blood pressure concerns can alert a patient to receive medical attention, as well as prevent any emergency situations from occurring during a dental visit. We document the blood pressure information in the chart to establish a baseline for the patient. This information should be updated every 6 months. Next, using a perio probe, a blunt instrument with depth indicator lines, we evaluate and document gum recession, pocket depths, and the patient's bone levels. We probe 6 spots around each tooth to assess tissue depths. Measurements of 1 to 3 millimeters are considered normal. When depths are determined to be 4 or greater, it is less likely that the patient is able to clean these areas effectively. Our combined goal with the patient is to work at decreasing those depth numbers. The next step is to go over risk factors that contribute to their oral health. There are 3 areas of risk that we address: systemic and behavior factors, periodontal factors, and caries risk factors. With these in mind, we can work with our patient to create steps that address their original concerns and to get their teeth and gums in optimal health. We have the patient sign the risk analysis and treatment plan to document their willingness to commit to those steps. Unlike other healthcare products, toothbrushes and floss purchased at the store do not come with instructions for use. This is a great opportunity to teach our patients how to properly use these tools and understand the benefits they can provide by helping them to clean all tissue surfaces thoroughly. With a toothbrush, you want the patient to use circular brushing with a 45-degree angle to effectively clean the gums and teeth at least twice a day. We also remind patients that massaging with toothbrush bristles is good for their gums. It also removes plaque that can have causative factors for gum disease and tooth decay. Additionally, C-shaped flossing removes plaque below the gum line that brushing alone may not be able to reach. After removing calculus and plaque from the patient's dentition using ultrasonic and hand scaling techniques, dental aids are given to the patient and they are scheduled to come back for routine care according to their treatment plan. All the steps in the process of care are interrelated and modified as needed depending on future evaluations, with the ultimate goal being the patient's overall good dental health.